Catholic College in St. Anne's and runs around the clock, concluding Sunday morning at the courthouse in Bedeque. Mr. Speaker, I'd like to ask the House to join me in thanking Race Chair Dave Parkinson and all the volunteers that make this event such a huge success, and wish all the runners the very best of luck in the race. Thank you.
Thank you very much. That concludes the time allotted for member statements. We'll now get ready for oral questions put by members to ministers. And we'll wait out the clock. We'll now move on to oral questions put by members to ministers. The Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is to the Premier. Last year, the government began limiting doctors from working in walk-in clinics. In fact, an order from the Nova Scotia Health Authority informs doctors that, and I quote, requests for new physicians to work in walk-in clinics will most likely be denied. And I'll table that order, Mr. Speaker. For thousands of Nova Scotians who don't have a family doctor, a walk-in clinic is the next best way for them to get the health care that they need, Mr. Speaker. The step after that would be an emergency room. So I'd like to ask the Premier, why is his government making it harder for families without doctors to at least go to a walk-in clinic?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. We continue to work with the Health Authority to ensure that we continue to recruit doctors across our province. Mr. Speaker, there are many ways that will be delivered. In some cases, some of those doctors will work in walk-in clinics. Some of them will actually do both, work in a walk-in clinic as well as run a practice. Depends on each physician and how they want to actually operate their private business. But we're going to continue to work with the Health Authority to make sure, Mr. Speaker, that we have physicians across this province, as well as working with other health care clinicians to ensure that we provide the appropriate health care team in communities across Nova Scotia.
The Honourable Leader of the Official Opposition.
Mr. Speaker, the Premier promised every Nova Scotia family would have a doctor if there was a Liberal government, but that is not happening. There are thousands of families today, Mr. Speaker, without access to a family doctor, and yesterday the Minister of Health wrote off 40,000 of them by saying that they don't want one. Well, Mr. Speaker, that's not what people were promised. They need a family doctor. When they don't have a family doctor, they should at least be able to rely on a walk-in clinic. The Premier says, well, there's a new plan that they'll work collaboratively. Well, you know what, Mr. Speaker? The Health Authority itself says that that new collaborative plan is at least 5 to 10 years away. So why is it okay to leave Nova Scotia families without family health care at a clinic when the plan to replace it is at least 5 to 10 years away?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. He's completely wrong. If he'd at all been paying attention to what's been happening across this province, he would recognize, Mr. Speaker, that health care teams are collaborative practices are working across our province with nurse practitioners, with doctors, Mr. Speaker. The Honourable Member from Pictou East continues, he can try to perform and have some performance if he'd like, Mr. Speaker. But the reality of it is, we're going to continue to work. We're going to continue to work with our health authority. We're going to continue to work with those Nova Scotians, Mr. Speaker, who are focused on the future. We're going to continue to work with our health care teams to make sure that we're providing the appropriate health care services across our province.
The Honourable Leader of the Official Opposition.
Mr. Speaker, it is the Premier that is completely wrong. Dr. Lynn Harrigan, Vice President of the Nova Scotia Health Authority, says, and I quote, trying to build up a system of collaborative care practices is a long-term process that will take up to 5 to 10 years. Mr. Speaker, families need doctors now. They were promised doctors now. It is a fact that there are thousands of Nova Scotia families without access to a family doctor today. When they don't have one, they should at least be able to rely on walk-in clinics. Until there's a new plan in place, it's only fair to allow them to use those walk-in clinics. So I'll ask the Premier, will he reverse the ban on adding new doctors to the walk-in clinics until there really is enough doctors to supply all Nova Scotia families?
The Honourable Premier.
Thank you, Mr. Speaker. And again, I want to thank the Honourable Member for the question. And if you actually listen to what he was reading there, Mr. Speaker, what Dr. Harrington has said, there's collaborative practice being created across our province today, Mr. Speaker. We're continuing to work with staff continue to make sure we provide that collaborative team approach. The honourable member would know there are walk-in clinics that physicians are working in today. They are not changing. That is not changing. They continue to work in those walk-in clinics. Mr. Speaker, it is our hope, Mr. Speaker, that across our province we're going to continue to work with Nova Scotia communities to make sure that we have a collaborative healthcare team Nova Scotia will call their primary healthcare team delivery.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, recent charges against a doctor in Tantallon have shed light on ongoing concerns about opiate use in Nova Scotia. A UN report says that on a per capita basis, Canada consumes more prescription drugs than any other country in the world. In March, the Centres for Disease Control and Prevention published guidelines urging doctors to try non-drug approaches, first to treat chronic pain and to prescribe opiates sparingly, and I'll table that. So I do ask the Premier, what is the government's position on the current state of opiate use in Nova Scotia?
The Honourable Premier.
I want to thank the honourable member for the question. Obviously, Mr. Speaker, healthcare providers, doctors, pharmacists across this province are people who prescribe the medications. The honourable member in her question raised an important piece. I think many Nova Scotians are looking for alternative ways of dealing with healthcare issues. We've seen it. And I would add to that piece, Mr. Speaker, that we as citizens need to begin to take control of our own health care, ensuring that we continue to begin to live healthier lifestyles. I said the other exciting piece, we are a generation right now that's going to have an opportunity not only to do that, but we get an opportunity to shape what our healthcare delivery model looks like with the current announcement around the new hospital and some services being moved out into community where people are living. This is an exciting time to, in terms of the healthcare delivery model change that we can make for the next 50 years. But when it comes to prescribing to prescriptions to patients across this province, that obviously would be between the doctor and their patient.
The Honourable Leader in the House for the New Democratic Party.
Thank you, Mr. Speaker. But just a few weeks ago, the Auditor General was critical of this government's sluggish pace in implementing a prescription drug monitoring program. Today, the Department of Health has said that there will be further delays in implementing this program. So, Mr. Speaker, in response to a lack of government action on this issue, Nova Scotia's College of Physicians and Surgeons has begun its own initiative to rein in opiate prescriptions. So I ask the Premier, why is the government dragging its feet on this serious issue?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. I continue to work with our healthcare providers across this province. She referenced the physician organization. We'll continue to work with them, Mr. Speaker, and we will ensure that that is implemented as quickly as possible.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, for those suffering from addiction to opioids, access to health services can make the difference between life and death. This morning, our caucus spoke with a man in Cape Breton who said access to a methadone program helped save his son's life. In late March, Direction 180 in Halifax announced it had to lay off staff, reduce its hours, and stop accepting new patients because of a lack of funding. It has made an appeal to the provincial government for more funding. So I ask the Premier, will his government answer the call for more funding to support the work of Direction 180?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. That request would have gone to the Minister of Health Department. We have provided the same funding they were provided with last year, and the request that has come in is being reviewed.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. Mr. Speaker, my question through you is to the Minister of Health. Mr. Speaker, the Minister and his party need to find a way to address the doctor shortage in Cape Breton. They, in their campaign, promised a doctor for every Nova Scotian, but when it comes down to it, the Minister relies on statistics rather than listening to the stories of real people who need doctors. You know, Mr. Speaker, the first step is for him to admit there's a problem before he can fix it. Mr. Speaker, my question to the Minister is quite simple. Is the Minister aware of what a doctor's activities have to be for them to be included in the doctor-patient ratio that he is so fond of quoting?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and it is a very important issue, not just for Cape Bretoners, but for all Nova Scotians, that we have strong recruitment, and for the first time, the NSHA now has a team that is working, in fact, every day, literally around the clock, to recruit for the province. We have 10 new doctors going to Cape Breton. We've just been able to fill 2 for Neils Harbour that were so difficult to get places for. We're making progress, Mr. Speaker, and we'll continue to make more.
The honourable member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker. Mr. Speaker, many of the doctors in Cape Breton and other areas as well have large practices with well over 1,000 patients. When those doctors leave or retire, it leaves thousands of people without a doctor. The minister is so fond of saying that there's 10 more doctors coming to Cape Breton. Does he know that there are 16 that are leaving? Mr. Speaker, is the minister aware of how many of the new doctors coming to Cape Breton Island will be taking over full family practices, and how many Cape Bretoners will still have no doctor?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. We're on a path to improve the recruitment process for all of the province, and yes, while 10 will be coming this year, 10 more are being recruited. 10 more are being recruited for Cape Breton, and that will give us a +4.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. It's been 111 days since the 57 dedicated workers of the Chronicle Herald have been on strike at Canada's oldest independent newsroom. We're joined today by many of those dedicated workers who are on strike and are hoping, Mr. Speaker, to get back to work soon. The Halifax Typographical Union has written to the Minister of Labour asking her to appoint a mediator to try to assist the parties in reaching a settlement. I'd like to ask the Minister, does the Minister agree that it's time that the government step in and appoint a mediator to hopefully resolve this ongoing strike?
The Honourable Minister of Labour.
Thank you, Mr. Speaker. I respect the collective bargaining process and remain neutral during negotiations and labour disputes. It's best to let the parties speak for themselves, but I can confirm that a mediation officer from LAE's Conciliation Services Division has already been appointed in the matter. The officer and Conciliation Services remain available to the parties and willing to assist in any way. I have also asked the Chief Industrial Relations Officer to contact both parties to reiterate this and determine if they may be of assistance. I would ask the honourable member to join me in strongly encouraging both parties to return to the bargaining table to work towards reaching an agreement.
The honourable member for Sackville-Cobequid.
Mr. Speaker, I respect the minister wants to stay neutral, but when we're dealing with these workers who have been, many of them working for over 30 years, at this independent newsprint, Mr. Speaker, it's important. I think that the government does have a role to play, and I'll stand here in my place and encourage the government to do whatever they can to go in that direction. I know the workers are willing to go there. It's the employer who needs some nudging, I think, from the government. We've seen the government refuse to stop advertising in the newspaper. That just helps them continue the business they're doing now with scab workers, Mr. Speaker. So at least will the Premier agree to stop advertising in the Herald, so hopefully push the employer to get to a mediator to hopefully settle this strike.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. Minister of Labour and Advanced Education expressed courage to both sides get back to the table to get an agreement, Mr. Speaker, that both sides can live with. Mr. Speaker, we're going to continue to communicate with Nova Scotians across the province. We're going to use the forms available that we can to make sure that we get our message out on programs and directions that the province is moving forward with.
The honourable member for Pictou Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health and Wellness. Mr. Speaker, 2 surgeons at the Aberdeen Hospital in Glasgow are going above and beyond what should be expected of them Basically, they have to be on call 24/7. That is, they are actually expected to work every second weekend, even after they have already put in long hours during the week that are physically exhausting. In order to rectify the situation, a locum is brought in every 3 weeks. Mr. Speaker, this is extremely expensive, using valuable health care dollars, paying for their flight, paying for their lodging, paying for their food and other essentials. My question to the Minister, would the Minister agree that this situation at the Aberdeen is unacceptable and the Provincial Health Authority should have added a third surgeon to avoid present personnel burnout and also save taxpayer dollars long before today?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I thank the member for the question. He raises a very, very important point. The Aberdeen Hospital has, full surgical services, including a very specialized orthopedic team there, and I know Dr. Bill Lowe has taken on recruitment in a very significant way, both for GPs and specialists for that zone, and we hope to have results from those efforts to be seen very soon.
The Honourable Member for Pictou Centre.
Mr. Speaker, we are rapidly approaching a dilemma in Pictou County. Unfortunately, a family doctor recently passed away, and at least 4 other doctors with large practices are past retirement age. Another family doctor is absent due to health reasons. We are already facing a doctor shortage, and the problem is going to escalate. My question to the Minister, will the Minister admit that Pictou County is facing a doctor shortage and there doesn't appear to be a solution in the foreseeable future?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I met just this week with the CEO, Janet Knox, as well as Board Chair Stephen Parker in the first year of the Health Authority's operation. They needed to look at a whole array of programs and standards across the province, and stabilizing the financial system of the Health Authority has been very, very successful in its first year of operation. This year, one of their top 3 priorities is a constant plan to recruit for the needs that we have right across the province.
The Honourable Leader of the Official Opposition.
Mr. Speaker, my question to the Premier. Over 18 months ago, the government banned high-volume hydraulic fracturing, Mr. Speaker, without even knowing what it was. Nova Scotians were promised a definition by the end of 2014 with public consultations to follow. Mr. Speaker, the Department of Energy was ready to go, both with a definition and the public consultations that Nova Scotians had been promised, but the government told the department, no, Mr. Speaker, don't go forward. I'd like to ask the Premier, why did his government reject the department's plan to release the definition of high-volume hydraulic fracturing to the public?
The Honourable Premier.
Thanks. Thank you, Mr. Speaker. I want to thank the gentleman for the question. As I've said, this House, one of the great successes off the shore off our coast has been great work that was done by began to be done under the McDonnell government, which was mapping the ocean floor to identify what we had, what was there, to be able to take out to industry. We're in the process of mapping, Mr. Speaker, onshore to identify if the resource exists, where it exists, what's the volume of it. The honourable member would also know that there had been some drilling that took place in I believe it was in Hants County, where all that was left behind, Mr. Speaker, was fracking waste. We spent an awful lot of time to deal with that issue. I think it's appropriate before any community, we go to any community, that we can honestly tell them what we can do with that waste and what's an appropriate way to deal with it in a safe environmental way.
The Honourable Leader of the Official Opposition.
Mr. Speaker, our offshore has seen billions of dollars in private investment and thousands of jobs. We have an opportunity to do the same thing here with onshore gas, but as long as the government has no idea what it is they've banned, not a single cent's going to be developed to make it environmentally responsible or to allow the jobs that we need to come from that resource, Mr. Speaker. Now we know from a Freedom of Information request, which I will table, that the department does have a definition of what the government banned, but they won't tell the public what it is, Mr. Speaker. So I'd like to ask the Premier, what is the definition of high-volume hydraulic fracturing that his government is hiding from the public?
The Honourable Premier.
I want to thank the honourable member for the question again. I want to tell him the work's happening across the province. We're doing the onshore mapping to identify, Mr. Speaker, whether or not that resource even exists and to what volume it exists in the province. Again, I go back to tell him that when there was some activity to take place in Hants County, the only thing the province got out of that was fracking waste, Mr. Speaker. We've been dealing with that issue. We want to make sure that it can be done in the most appropriate environmental way. And we're going to continue to do so by working with our partners across the province. As the honourable member would know, that before there's any activity on land, there needs to be, we have the duty to consult in this province. None of that had been done prior to that. So there's ongoing work. The minister is looking across the country, the activity that's taking place. So, Mr. Speaker, we'll continue to work with industry. We'll continue to work with communities across this province to make sure that we maximize the resources that we have in this province.
The honourable member for Pictou East.
Thank you, Mr. Speaker. My question is also for the Premier. During the 2013 election campaign, the Premier promised the Pictou County Injured Workers Association that he would take action to fix the workers' compensation system. He also said that he saw the need to increase benefits, and he promised a royal commission into the system. 2.5 years later, we've seen nothing on this, so my question for the Premier is very simple. Does he intend to honour his promise and strike a royal commission?
The Honourable Premier.
Speaker, I want to thank the honourable member for the question. I want to thank workers across our province. The people at WCB have been working with workers across Nova Scotia. As you know, there's a huge unfunded liability there. They've been working through that process. Mr. Speaker, we're going to continue to work with them to make sure that we have in place a system that if any work in the province requires support, financial support, that is the appropriate amount for that worker to look after his family, Mr. Speaker, if they've been injured on the job.
The honourable member for Pictou East.
Well, Mr. Speaker, it was a simple question. Keep the promise or not? So I think what we're hearing today, after a few people were thanked and a few other things, I think what we're seeing today is injured workers can join the list of people that work in the film industry that had a promise broken by this government, can join the list of people that expected fixed election dates that had that promise broken by this government. And today, it's a very simple question. I'm going to give the Premier one more chance to see if he's decided over the course of 2.5 years whether or not he will honour his promise. And his promise was that he would strike a royal commission. Mr. Premier, will you keep that promise or not?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. I think he's being a bit loose with the facts, Mr. Speaker, but then again, he's auditioning for a future job, Mr. Speaker, and he takes every opportunity, when he gets to the House, Mr. Speaker, instead of actually dealing with the facts, Mr. Speaker. He's auditioning for a future job.
Order, please. The Honourable Premier has the floor.
Thank you, Mr. Speaker. He continues to audition for a future job, Mr. Speaker. He wants to solve problems for the people of Nova Scotia, Mr. Speaker.
Order, please. The Honourable Premier has the floor.
I encourage the honourable member, if he wants to solve problems for Nova Scotia, maybe he should stand up and be thoughtful about and worry about the people he's spending instead of auditioning for a job, Mr. Speaker, that's not vacant at this time.
The Honourable Member for Dartmouth East.
Thank you, Mr. Speaker. My office has received a number of calls from people in the Pictou County area saying that the wait time for Pap tests has increased on average from 2 weeks to 7 weeks. And we've been able to confirm that delay. By calling a number of clinics and individuals. And I'm wondering if the Minister of Health can explain what changes, if any, have occurred resulting in the longer wait times and whether that delay is just limited to Pictou County.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I am not provided with every diagnostic test in terms of wait times. I certainly know those major ones that are a constant concern to Nova Scotians, and what I'll tell the honourable member is that I will look into that issue for him and provide as to whether or not it's right across the county. Is it one particular clinic that may be affected by a change in practice?
The Honourable Member for Dartmouth East.
Thank you, Mr. Speaker, and I do appreciate very sincerely that answer. In looking into it, we've been told by medical staff at the clinics that the delay is because a change either closed the lab in Pictou County that was doing the tests, or that they are no longer doing these tests and that the tests are now shipped to the Valley and Truro labs. And I'm just wondering whether, when he looks into this, and I understand he doesn't have the answer right now, whether he could look into whether that change, why that change may have occurred, and whether that is why the tests have gone up to 7 weeks, and whether there would be a plan to address the delays that have occurred.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I know when diagnostic services do change sometimes in the early weeks, the flow of test results may not be as quick as what an area of the province may have been used to, but I'll certainly provide full information for the member on that particular question.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. The Federal Minister of Indigenous and Northern Affairs has now announced that Canada will be fully adopting the United Nations Declaration on the Rights of Indigenous Peoples. This is a welcome announcement. However, it does not ensure that Nova Scotia's First Nations communities will be included. So, Mr. Speaker, one of the Truth and Reconciliation Commission's calls to action is that provincial governments fully adopt and implement the Declaration as the framework for reconciliation, an action not yet taken by the Premier. So, Mr. Speaker, will the Premier commit today to fully adopting the UN Declaration in Nova Scotia?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. Mr. Speaker, we continue to work with the First Nations communities across the province. So we have a great working relationship, something that was started by successive governments. I believe it might have been Dr. Ham's government at the time. The Honourable Michael Baker might have been the minister at the time, where we began to invite the chiefs from the communities across our province to sit down with the Executive Council. That will take place again, I believe it's in June, second time. We'll continue to work forward on a whole host of issues. We're very pleased to work with them. We're announcing that part of the curriculum in this coming year we'll talk about treaty education. I've said many times we're all treaty people. All of us have that rights and responsibilities associated with those treaties. Mr. Speaker, we're going to continue to work with First Nations communities to deal with those issues as well, Mr. Speaker, with the issue that the honourable member has brought forward.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker, and I want to commend the Premier for his actions on education for our First Nations people. I think that's a good first step. However, I'm not sure why he won't commit fully to adopting and implementing the whole landmark United Nations Declaration, because it ensures that First Nations individuals and communities are empowered to assert their rights to their land, health, culture, and social outcomes. And without the Declaration being adopted and implemented fully, then the Premier, who is also Minister responsible for Aboriginal Affairs, leaves Nova Scotia without a clear framework for the reconciliation. So what rationale does the Premier have for not fully adopting the Declaration in Nova Scotia, since we are all treaty people?
The Honourable Premier.
I want to thank the honourable member for the question. Mr. Speaker, we'll continue to work with our First Nations communities to continue to make sure that they become the vibrant communities that they are, Mr. Speaker, that their cultures continue to be respected. And quite frankly, Mr. Speaker, the issue of putting treaty education in education is to not only, Mr. Speaker, ensure that First Nations communities understand the rights and responsibilities associated with the treaty, but all Nova Scotians understand that. Our children, next generation of young Nova Scotians will understand that. We're inviting them in actually to do both the education chief to come to our caucus to actually talk to us about treaty education and their thoughts of it. I encourage the opposition caucuses to do the same. We're going to continue to work with our First Nations community, Mr. Speaker, to make sure that they are respected communities across this province. They've done a tremendous amount of work, and they've worked very hard, Mr. Speaker, to ensure that we provide opportunities in their community for us and the government.
The honourable member for Inverness.
Question for the Minister of Communities, Culture and Heritage. Mr. Speaker, the Recreation Facility Development Program, an important investment in Nova Scotians' wellness. We know this program has been moved from health to communities, culture and heritage. But typically, Mr. Speaker, over the past year, organizations would have been able to interact with the government. They would have been able to put forward projects for funding. They would have had discussions about how those projects could be funded and how other partners could be brought in to fund those projects. My question to the Minister, what will be the process for community groups who wish to apply for funding this year based on this budget, and when is the program deadline?
The Honourable Minister of Communities, Culture and Heritage.
Thank you, Mr. Speaker, and thank you for that question. First of all, I'm very proud that the program has been moved to our department. It's a very positive move. It will help communities across the province in these types of ventures. That being said, because of the change and the transition, we are still looking at, Mr. Speaker, some of the program details. I would encourage any community group who's looking for funding within that to contact our office, and we will reach out and work with them to try to help them move forward. Thank you.
The honourable member for Inverness.
Mr. Speaker, I appreciate the response. I know that people who were working, I presume people who were working in the Sport and Recreation Division are now over in the Minister's department, and they would be the contact people. But my follow-up question is, how will this recreation facility development program be publicized so that everyone has a fair chance to apply? My concern is if there was a deadline of, say, May 30th, many groups might not be aware of the deadline. They might not be able to get in on time. So my question for the Minister, how will the program be publicized so everyone has a fair chance to apply?
The Honourable Minister of Communities, Culture and Heritage.
Thank you for that. To answer your question, there are regional directors, and there's also accessibility on the website to start for anyone to get that information. Thank you.
The honourable member for Pictou East.
Thank you, Mr. Speaker. My question is for the Acting Minister of Transportation. Nova Scotia taxpayers recently learned that they'll be paying for some paint to be laid on some asphalt in the city of Portland. I'd just like to ask the Acting Minister, if there's a little bit of paint left over, can we get a splash of that on Nova Scotia roads too, please?
The Honourable Acting Minister of Transportation.
Thank you very much, Mr. Speaker. I appreciate the question. It's important to be clear here. The entire cost of the new Nova Scotia ferry to Portland is in the budget. It's there for everyone to see. There is a cost associated with upgrading the terminal, but to be clear, it's on the ramp and the control mechanisms to ensure that traffic can go on and off of that vessel, Mr. Speaker. I understand that the opposition members don't want this ferry to be successful, but I would assure them that we do need an on and off ramp, Mr. Speaker, to ensure we can bring all those Americans here to Nova Scotia and back again.
The honourable member for Pictou East.
Well, Mr. Speaker, what we want is we want all the facts. And we want people to have the facts, and it's interesting the minute the Acting Minister talked about the work on the infrastructure there, because I know that federal wharves are a federal responsibility here in Nova Scotia. I don't think the province pays for any wharfs, but we do now pay for wharfs in the city of Portland. So I would like to ask the Acting Minister, has he lobbied for a little bit of cash to work on some of the wharfs right here in Nova Scotia that are used every day?
The Honourable Acting Minister of Transportation.
Mr. Speaker, I want to be clear. There's no money going towards a wharf in Portland. What's happening is we are investing in an on and off ramp so that people can get onto the ferry to come here to our province, Mr. Speaker. It's interesting the line of argument that the members of the opposition have been putting forward, Mr. Speaker. I want to read a quote here.
Order, please. The Honourable Acting Minister of Transportation has the floor.
Thank you so much, Mr. Speaker. I have a quote here. What I wanted the people of Yarmouth and Nova Scotia to know, and I also made this very clear to the Ferry Partnership, is the PC Party has always supported the Yarmouth Ferry, even when it needed financial help, Mr. Speaker. That's the Leader of the Opposition, 2012. Now we have a recent quote, Mr. Speaker. I guess the taxpayers are just supposed to pay as long as it saves the seat in Yarmouth. Mr. Speaker, according to the member for Argyle, the ferry return for dollars was $175 million. According to the Tories' own math, Mr. Speaker, that's a 75% return. Why are they now turning their back on the economy of Nova Scotia for partisan purposes?
The honourable member for Kings North.
Mr. Speaker, my question is for the Minister of Business. Mr. Speaker, Tuesday we did not get any answers on the Cushman-Wakefield contract to sell Digby Pines and Liscombe Lodge. This company was paid to help manage the sale of these properties through the public tendering process. It also appears that parties that did not engage with Cushfield-Wakeman or with the tendering process may have had direct access to the Minister of Business. My question for the Minister is this. Did the Minister, his department, the Department of Municipal Affairs and Tourism of Nova Scotia or other departments or agencies intervene on behalf of parties interested in these properties that did not participate in the public tendering process? Yes or no?
The Honourable Minister of Business.
Thank you, Mr. Speaker. And if I recall the questions from previous question period, I did answer the question. They asked about Cushman Wakefield and the RFP. That concluded. We accepted applications during that period, Mr. Speaker, and we were open at the time. We continue to accept applications after that time, Mr. Speaker. At no time has any department or agency interfered in the process. Mr. Speaker, MLAs have been fulfilling their role. Members on that side of the House as well, who have expressed an interest in the viability and the long-term sustainability of our provincial resorts. We've worked amongst MLAs and others to ensure that the information that is required for people to submit interest and potential purchase of that property, Mr. Speaker, is open and transparent.
The Honourable Member for Kings North.
Thank you, Mr. Speaker. I'd like to thank the Minister for that answer. It's my understanding that Cushfield Wakeman has been engaged to sell the property and that the Minister and other departments are possibly getting involved in the actual dealing with interested parties. Will the Minister confirm that Cushfield Wakeman is the agency or the organization doing the sale, not the departments themselves?
The Honourable Minister of Business.
Thank you, Mr. Speaker. Mr. Speaker, Cushman Wakefield was contracted for a specific period to manage applications. They are recognized globally as a real estate company that specializes in the movement of these types of resorts. The contract ended. There were applications and expressed interest during that period, and there have been expressed interests since that contract period has expired, Mr. Speaker, and we will continue to accept interest in that property, in those properties. My colleague from the Conservative Party knows full well, going back to when they were in government, that we should not be in the position of owning real estate. We will do our best to transition those properties, and in the interim, they will continue to function as tourist resorts and destinations for visitors this coming season.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, as we know, many Nova Scotians are struggling to find a family doctor. For some, it's because their family doctor is retiring and closing up their practice. When they find a new doctor, it's essential that patients are able to provide their medical history and personal information to their new health care provider. Although the physical records belong to the physician, the patient has a statutory right to their own information. So, Mr. Speaker, I'd like to ask the Minister, can the Minister explain why some patients are being charged a fee to have their health information transferred to their new health provider?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. During my time in office, I've heard of doctors who have provided patients their records when they are terminating their practice. Others charge $100 per patient. I've had a family of 5 in my office wanting an explanation, and of course that's the private business part. But I've had them contact the college to help facilitate the movement of their records to another doctor.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, I've heard from patients of Dr. Jones whose practice closed because she's facing serious drug-related charges. Those families are being told that they need to pay a fee to file transfers to their new family doctor. However, Mr. Speaker, in a Doctors Nova Scotia magazine from March of this year, it clearly states that the Personal Health Information Act prohibits a physician from charging for access. The Act says personal health information must follow the patient free of charge when the patient changes physician or expands their circle of care. And I'll table that, Mr. Speaker. Will the Minister agree to step in and help those families that have paid or who are being asked to pay this unnecessary fee?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. That'll be done this afternoon.
The Honourable Member for Pictou West.
Mr. Mr. Speaker, my question through you is to the Minister of Municipal Affairs. The Halifax City Council passed a motion requesting the province provide a greater autonomy to set commercial taxation levels by area, and I can table that. The Minister has suggested that this is something they are reviewing. Can the Minister please provide a timeline as to when this change may be implemented or rejected?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. It does very well fit within our government's philosophy on economic development throughout the province to engage our communities, engage our private companies so that we can all be invested in this together. We are in constant conversations with UNSM, all of our municipal units, to discuss how best to do that. The issue of taxation obviously has come up, and those conversations are ongoing with HRM and all of our municipal units.
The Honourable Member for Pictou West.
Mr. Speaker, small businesses are looking for tax relief, as we all know, and this is especially true in areas on Quinpool Road, where property values have continued to skyrocket. Some members of the public and the business community in that area are very concerned that if the requested changes are not approved before the next municipal election, the process will have to start all over with a new council. Has the Minister had any direct meetings with these concerned business owners? Thank you.
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. As the Minister of Municipal Affairs, I have met with business owners. I have met with their representatives through the CFIB, with the Chamber. I am very well aware of this request that has come forward. It is one that we are taking serious consideration of and discussing. And any changes when it comes to our tax structure, they're important changes, Mr. Speaker. They will have long-lasting effects. We need to do our due diligence on the front end to ensure we're making the right decision for the long run.
The Honourable House Leader for the Official Opposition.
With the loss of the EHS Lifelight, the Minister now needs to deal with contracts that support the previous service. There are three options for the government to respond to the Transport Canada ruling: buying or leasing a new helicopter, asking for an exemption from Transport Canada, or making do with the current situation. The Minister told us last week that the province would be buying a new helicopter. So will the Minister tell us or give us an update on where the process is to replace the Lifelight helicopter?
Honourable Minister of Health.
Thank you very much, Mr. Speaker. It is an important component of the delivery of health care in our province. We won't be purchasing a helicopter, but a company will be providing now the required helicopter based on the specifications of Transport Canada. That process is currently in the works, and an RFP will be part of that process as well.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. You know, new helicopters and new service agreements aren't cheap. And the service provided by Lifelight is, of course, important to public safety. Whether you're in trauma somewhere on our roads and byways of Nova Scotia, or whether you're in trouble in one of our hospitals and need to get here to Halifax, where they can receive the services that they require. So will the Minister inform Nova Scotians the date that he anticipates a new helicopter to be in place, and service will continue to the IWK, to the QE2, and to the Digby Hospital?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the honourable member for that important question. We know that it will be about a 6 to 9 month turnaround for a company to procure a new helicopter that will be leased by the province, and an RFP process will be required in order to achieve that. And what I can tell the honourable member and all Nova Scotians, that process now is moving along as quickly as possible, and I'm pleased to say that within about 48 hours of finding out the Transport Canada ruling, there was certainly, I as Minister was not going to ask for any further exemption. The safety of Nova Scotians at all times is paramount in our health system.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. This question is for the Minister of the Environment. One of the government's own members has made a serious allegation against her department. In a recent article published in The Laker, the member for Waverley Fall River Beaverbank said, and I quote, "I don't think the department is interested in keeping our environment safe. There have been many cases where they are making the wrong decisions. It would appear that they're making those decisions for the wrong reason." I'll table that, Mr. Speaker, and I'd like to ask the Minister if she can respond to this allegation.
The Honourable Minister of the Environment.
Thank you, Mr. Speaker, and thank you so much for the opportunity to respond to this. I want to thank the member for Fall River Beaverbank for all the work he's doing to support his constituents. We've had many conversations about issues in this community, and many of us made commitments in our communities to favour certain projects. I certainly loved doing things about the tidal bore on the Knowles Shore. So this has certainly been his issue. The Department of Environment is a regulatory department, so decisions on industrial approvals are all based on science and fact-based decision-making when assessing province. Evidence and science-based decisions, that's what we rule on. Application for approvals, the proponent has to meet the terms and conditions of the approval with the consultation period. So if approvals are granted, they have terms and conditions that mitigate any risk to the environment. So persons or groups who disagree can also appeal that decision.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. And it's interesting to note that the Minister is saying that people have been supporting things in their ridings, especially since she supported the Alton Gas people against that project. However, Mr. Speaker, the Fall River Quarry is not the only controversial quarry proposal on the government's radar. In the Premier's own riding, the proposed Brooklyn Quarry has also been met with resistance. In November 2014, local residents picketed the Premier's constituency office to show their opposition to that quarry. So can the Minister please give us an update on whether this quarry has been approved?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker, and thanks to the member opposite for the question. What I can tell her is that all of us bring to this House things that we are engaged in, things that we're passionate about. But this isn't old-time politics, Mr. Speaker. Nova Scotia Environment operates with a regulation based on the laws of this province and will continue to do so under this minister and this government.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. My question for the Minister of Energy. The ComFit program ended last year, and at the time there were several projects that were still going through the construction process. So my question for the Minister is, does he have an estimate on the number of ComFit projects that are waiting to be constructed?
The Honourable Minister of Energy.
At my fingertips, no, but I'd be more than happy to get him that information.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker, and I appreciate that for the Minister. And I understand that there are some projects that have been given extensions as to when they would start the construction process, maybe a couple extensions in some cases. I'd just like to ask the Minister, is there a point in time where the Minister will cease issuing extensions on ComFit projects that are in the funnel?
The Honourable Minister of Energy.
The entire goal with the project is that there's been some deadlines. Now, there has been some occasions, both for approvals that were granted prior to us taking government, that ran into some issues that did require some extensions. So we try to be as reasonable as possible, but operators need to know that when they do put in for a ComFit proposal, that there are time frames that they are expected to adhere to. Again, we try to use a reasonable approach when there are certain issues that may cause delays that are completely beyond the control of the proponent, such as weather delays or others. So, but we're more than happy to provide more information on that if the honourable member wishes to request it.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Yes, I actually asked the Minister of Environment about a particular quarry, that asking her if it has been approved, and I didn't hear an answer there. And in fact, the one that I'm asking about is another controversial quarry, which was called the Brooklyn Quarry, which is in the Premier's riding. And in November 2014, local residents picketed the Premier's constituency office to show their opposition to that quarry. So my question for the Minister is, can she give us an update on that quarry as to whether it has been approved?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. The Honourable Members. Thank you, Mr. Speaker, and thank you, the member opposite, for the question. To that particular quarry, I can't speak to yet. I certainly can get her that information. But I think what I wanted to make a point is it doesn't matter if it's the Premier's quarry, whose quarry it is. There's no political interference in this process. This is all about following the regulations of the departments and the terms and conditions. Thank you.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you very much. And I heard that response, but I did not hear an answer. Has that quarry, in the Premier's own writing, been approved, yes or no?
The Honourable Minister of the Environment.
That's all I want to know.
Thank you, Mr. Speaker. I don't know what part the honourable member missed on that. I did say that I didn't have the information on that, but I certainly would make it available to her.
The honourable member for Pictou West.
Mr. Speaker, my question through you is to the Minister of Health and Wellness. I want to thank my colleague from Dartmouth East for bringing up a subject that I've been investigating a little bit about. There's a number of individuals that have called me in the last week with regards to not receiving the results of their Pap tests for over 6 weeks, Mr. Speaker. We know that cervical cancer is on the rise. I want to know if the Minister feels that waiting 6 weeks to receive the results is reasonable.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I know that that is a long period of time to get a test, and whether it's a regular part of an annual exam, or whether there's something suspicious as to why a woman went for a Pap test. And I don't think that, I think that is a lengthy period of time, and we will find out as to why this change has taken place, and I'll report to the member with that
Order,
information.
please. Time allotted for oral questions put by members to ministers has expired. We'll now move on to government business. The Honourable Government House Leader.
Speaker, would you please call public bills for second reading?
We'll now call public bills for second reading.
Speaker, would you please call Bill number 174, the Financial Measures 2016 Act?
We'll now call Bill number 174, the Financial Measures 2016 Act. The Honourable Member for Colchester, Musquodoboit Valley.
Thank you very much, Mr. Speaker. I wasn't sure whether I got my point across the other day when I spoke a few minutes on this. My major concern is the welfare of rural communities. I know that a lot of things have been put in place, road-wise, from the Department of Health, the Department